Welcome, everybody. Welcome. Hi, my name is Dr. Rappe. Wait here just a couple of more minutes. I've got one clock that says 4:58. I'm 5:01. So I just wanted to welcome everybody and say I'm really looking forward to sharing the information that we have with you today. Um, I'll share a little bit about myself and my education, and I'm also a thyroid person. So for anybody out there who's working with a doctor that's not a thyroid person, there's a huge difference. And I have Hashimoto's, and I'll show you a little bit of information about that as well. So I'm really excited tonight. We got a lot of great information. It's going to be pretty fast and pretty furious. Um, just keep up, and I'll do the best I can, but I want to get through the information. I don't want it to be too long for anybody, and so it's going to be a wonderful time. So just please bear with me. And again, I'm not the best at technical stuff, so I'll do the best I can, switch it back and forth. And also in the chat, you can ask questions. There will be a number of slides that will ask a question. I really hope that during those slides, you'll participate in the chat section. It gives us information about some individuals that we're talking with or that are on the webinar. And so it's really important that we do that. We find that we get better results with individuals when we have a little more information. So we'll do that as well. So the chat's going to be constantly monitored. If you have questions, we'll do the best we can to answer those. And again, I really appreciate everybody taking the time to actually come on and listen to what we have to say. So I'm going to start with my screen share. Here we go. And there it is. Okay, so tonight we're talking about thyroid. You have to understand something. If you want a different outcome, you've got to do something different. That's my motto, and I've been using that for many, many years. Again, for those of you who don't know me and are new, and I work with people all over the country, some people I've never seen before. This is the way, the format in which I've worked. I've done telemedicine for many, many years. It's either Zoom, FaceTime, or any type of opportunity. We've done work with just on the phone with people all across the country. So you don't have to literally be in my area to work with me. I've worked with people on the East Coast, on the South. I've clients in Canada as well. But again, one of my biggest mottos is if you want a different outcome, you've got to do something different. That's the bottom line. So who am I? My name is Dr. Rappe. I've been in private practice for 31 years. Yes, 31 years. It's been a long time, and I've literally seen tens of thousands of clients over that period of time. Very, 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 very busy. And so my background is I have a tremendous amount of postgraduate work done. I'm certified in functional medicine, 300-hour certification course. I'm board eligible in functional nutrition. I have close to 1,500 hours of postgraduate studies in functional medicine, functional endocrinology, functional immunology, functional blood chemistries, and metabolic testing, as well as functional nutrition. So my education is much more advanced than normal, and my main focus in my practice is functional medicine. I still do some other specialities as well. I've done laser work, and I started using lasers in 1989. So I've been using those for 31 years to heal tissue and whatnot. And so I just have an extensive background. When it comes to functional medicine, it's pretty straightforward. For those of you who are on here tonight who might not know exactly what functional medicine is, let me give you a definition that I think is easy. It's pretty straightforward. Functional medicine is almost too simple. The idea of functional medicine is we want to identify what is the underlying cause of your symptoms and then resolve the underlying causes using all natural methods. Again, we want to identify underlying causes of your symptoms and then resolve those underlying causes with all natural methods. When we resolve the underlying cause, your symptoms go away. Okay? Now, I'm not a medical doctor. I don't change anyone's medications. I don't make any alterations or suggestions with regards to medications. It's your job to continue to work with your medical doctor. And if we work together and get you better, your doctor's job then is to reduce and eliminate those medications that are no longer necessary. So the difference between functional medicine and what your medical doctor is doing is very straightforward. Our training is completely different. Their training is more geared toward what are your symptoms and what drug can I give you to minimize those symptoms. And as long as they've minimized your symptoms, you're good to go. The problem is, in my opinion, you're going to end up taking those drugs for the rest of your life. High blood pressure meds, cholesterol meds, thyroid meds, diabetic meds, heart meds. So again, the medical model is they identify your symptom and then they want to minimize it using drugs. It's really driven by the pharmaceutical industry, and that's why they work that way. It's a huge profit-making scenario for the pharmaceutical companies. They figured it out 50, 60 years ago. Make drugs that minimize symptoms. They take it for the rest of your life. You maximize profits. So again, functional medicine is about getting to the underlying cause, the root cause, resolving it, and then your symptoms go away. I can absolutely guarantee that most of the people that are on here tonight, the drugs you're taking will never, ever correct the underlying cause of your symptoms. They're not designed to do that. They're designed to minimize the symptoms. If they were actually designed to correct the underlying cause, you would only take them for a short period of time and you'd never have to take them again. Okay? So that's really the difference between what I do and what the medical model does. Now, I'm not anti-medicine. Don't get me wrong. I refer people out. There are certain medications that I'm all for. A personal story of mine, I have a brother of mine, he's a year older than me, had a double lung transplant in November of 2019. So the drugs that he takes every single day literally keep him alive. They keep his body from rejecting his lungs. Those are the kind of drugs I'm all for. But when it comes to the kind of drugs that are being used for chronic conditions, they just prolong the process and make people worse. And so I'm not in favor of those. So we're going to go through some slides pretty quickly here. What are we really going to cover tonight? America's healthcare crisis. I'm going to present it to you in a way that it might be eye-opening to most of you. And if not, then good, you're on top of your game. The underlying causes that no one wants to talk about, thyroid disorders in particular. I've already said to you that I have an autoimmune condition. So when I work with thyroid patients, it's a completely different experience than when they go to their doctor and their doctor just acts like there's nothing really wrong with them. He runs a couple of tests and says, you're fine, and gives you drugs. Okay? You're actually talking to someone who's taken his autoimmune condition, which is called Hashimoto's, and it's been in remission now for a number of years. So we're going to talk about some autoimmune. We're going to talk about lab testing. And then if you stay to the very end, you'll have an opportunity to book a free call with our clinic. And the purpose of what we call the discovery call is really to give you an opportunity to share a little bit about you. Again, this isn't a consultation. It's to help us understand what's going on and to see if what we offer in our practice, in our facility here, is a good fit for you. We only want to work with those individuals that we can help. I've turned away hundreds and hundreds and hundreds of people on a regular basis because if I don't truly believe I can help you, I will not even offer you a program. I'll just say, look, I'm sorry, but I don't think this is a good fit for us. And so we'll talk a little bit about that as well. We need to have a serious conversation about drugs. I just brought it up. The pharmaceutical industry is huge. They make money off of you when you're sick. They don't make money off of you when you're healthy. They dislike me. I've got a target on my back. I'm somebody that they don't like. And there's a number of us functional medicine guys out there they don't like because we get people better. And when we do that, they stop taking their drugs. I don't stop them. Their medical doctor does that for them. But when they stop utilizing those drugs, their sales drop and their numbers drop and their profits drop. So we've got to have a serious conversation about the drugs in this country. 75% of the $3.5 trillion that we spend on healthcare is spent treating diseases that are largely preventable. Let me say that again. 3.5 trillion every year is spent on treating diseases that are largely preventable. What preventable means is that I can keep from getting it. I've held lots of babies in 31 years. Probably had a few of them named after me, but I've held lots of babies in my time. And I've never held a baby that had heart disease. I never held a baby that had diabetes. I never held a baby that had high cholesterol or high blood pressure or any of the other chronic degenerative diseases out there today. And so what I'm talking about here is that the vast majority of the diseases out there today, and it is about 75%, are really chronic degenerative diseases that are preventable if we took the right steps from the beginning and taught people and educated people rather than just write a prescription of drugs to minimize their symptoms. United States healthcare system, or the medical model that everybody on this talk tonight is in, that medical model uses what's called acute methods to treat chronic conditions. And that's why our system is such a failure. Now, if you have your leg cut off in a car accident, they'll sew it back on. A heart attack, they'll save your life. All of those things are fabulous and wonderful, but that's not what we're talking about. We're talking about the vast majority of disease out there today is chronic degenerative disease that takes place over a long period of time. And the medical model uses the acute care, which is give them drugs to minimize symptoms, to treat these people. And that's why you end up taking drugs for the rest of your life. So that's really what leads to the failure of our healthcare system. And you'll see some of the statistics here in a second. In addition to that, 25%, or excuse me, in addition to that, we spend $225 billion a year on pharmaceutical drugs. This came from the CDC and the FDA. So $425 billion are spent on drugs every single year in the United States. Why is this important? Well, you can see there, the United States makes up only 5% of the world population. $425 billion represents 75% of all the drugs manufactured on the planet. Okay? We're taking them here, we're consuming them here because our healthcare system uses acute care to address chronic conditions. And everybody that's on tonight is experiencing that and has in the past and will in the future unless they choose to do something different. So what did COVID-19 reveal to us? Well, what it really revealed to us, it opened up our eyes to a lot of us. A couple things. One, 133 million Americans have at least one chronic disease, if not multiple chronic diseases, okay? 90% of all COVID-19 hospitalizations and 94% of all COVID deaths were for people that had at least one chronic disease. Again, chronic disease, obesity, diabetes. Diabetes was really big, by the way. Heart disease. These are all the kind of chronic disease we're talking about. So it's a huge percentage of individuals. We're really in crisis mode. If you look at our healthcare system, the unacceptable costs involved in our healthcare system, I just gave you the billions and billions of dollars, 3.5 trillion every year, unacceptable outcomes. 3.5 trillion is spent annually on healthcare. 90% of chronic healthcare conditions are out there. We double the amount other than other nations. So why do we spend more than any other nation? Because we're still using acute treatment modalities and acute methods to treat chronic disease. No one else is doing that. They're all involved in prevention. In the United States of America, the medical model, their idea of prevention is to give you a drug at an earlier stage. And again, that just minimizes your symptoms. It doesn't do anything to correct the cause. And we're going to talk a lot about cause. 70% of all deaths caused by the top 5 chronic diseases, and we're ranked 37 out of 40 in the healthcare outcomes worldwide. So really, it's, you know, oops, let me move this so you can see this. Okay, so what do you think the real problem is with our system? Is it wrong approach or is it lacking information? Type your answer if you would. I'd appreciate it in the chat box. Is it that we're taking the wrong approach or is it lack of information? Is that's what's really going on with our healthcare system? What do you guys think? Type stuff up there. I want to hear from you. Okay? Well, again, in my opinion, and again, I'm in the profession for 31 years, and a lot of my buddies are medical doctors, so I know a little bit about what's going on. The U.S. healthcare system or the medical model uses acute care methods to treat chronic conditions. That's the problem, I think. And that's really driven by the pharmaceutical company that really oversees what everybody's doing. So it's really important to understand, I think it's the wrong approach. It's not so much lacking information. Do you have control over your health? Absolutely you do. See, we can't eliminate our exposure, but what we can do is we can be proactive. We can read, we can research, we can work with a functional medicine doctor to help us understand what the right information is, what the truth is, not based on what the pharmaceutical companies want you to believe, but what's really the truth about your body and how it works. We can surely eliminate risk factors. Risk factors are big. We can figure out, most importantly, what's the underlying cause? What are your symptoms? Pre-diabetes. Why are you a pre-diabetic? There's a reason, and we have to address that, identify it, and then correct it. So we do that. We also want to boost the immune system. Right now, I'd suggest with all of the clients that we've worked with in the past, I'd say 5, maybe even 10 years, I don't think any of those individuals have contracted the COVID, because what we do supercharges your immune system. And that's really your number one defense against this COVID-19. It's not getting an injection. It's not taking any pills. It's not just one supplement, because I can take a handful of supplements, but if my body isn't working normally, they're not going to do me any good. Okay? And so it's not that we're trying to develop a drug that will kill the virus or suppress the virus. Those things are going to do. We want to boost our immune system, be as strong as possible, because believe me, when COVID is gone, something else is coming. We have to be prepared. For those of you on here tonight, you remember H1N1, you remember swine flu, SARS, remember all those they all came in a series, a succession. And that's what's going to happen with COVID. So we want to build our immune system to be as strong as possible. Minimizing stress is huge. This has been a very stressful time for a lot of people, whether it was financial stress, being cooped up and stressful, interactions amongst couples that are spending all this time together when they had time apart and working different jobs. Stress is huge. There's lots of research out there to show that stress actually causes disease. We'll talk a little bit about how stress can drive different organ systems to really throw you off metabolically. It can affect you from an endocrine standpoint as well. And then most importantly is you have to be willing to be willing. That means to take action. We can talk a big talk, but if we're not willing to actually take the steps necessary to get the results that we're looking for, then you're not going to get anywhere. It's year after year. You're going to do your New Year's resolution. I'm going to lose some weight. And then 2 months later, you're right back to where you started, because no one has taught you the right way to go about it and how to be successful. So if you just joined, I don't know, I can't see the people coming on here. That's not the way my computer is set up. But if you just joined us, we're talking about the healthcare crisis, underlying causes that no one wants to talk about. We're also going to be talking, coming up here, is thyroid disorders, autoimmune conditions, lab testing, which is going to be really interesting for most of you, as well as how to book a free call or a discovery call with our clinic. And that's really the purpose of that, is to identify if what we do in our office is a good fit with you. Because like I said earlier, we don't take everybody, because if I don't truly believe I can help you, then I won't even offer you a program. So here's the American model. Here's the medical model and how it works. What's the medical model's first thought when they see a client? Anybody? What do you think it is? Any guesses? Well, their first thought is, what medical condition do you have? They want to label you, diagnose you, and label you, because that's how they're able to. Angela raised her hand. Good job, Angela. That's how they're able to decide what drug to give you. They got to come up with a condition first, and then their second thought is pretty straightforward. Their second thought is going to be, what drug do they give you, or what drug do they need to give you to suppress your symptoms? That's how the medical model works, period. Now, all of my medical doctor friends, they're good people. They mean well. Your doctors are good people. They mean well. Their goal is to help you. The problem is they're trained in a completely different system, and this is their system. What's their first thought? What medical condition do you have? And the second thought immediately is, what drug do I need to give you to suppress your symptoms? Not correct the problem, not fix it and get rid of it, but how do I suppress your symptoms? That's their thought process. And it's drilled into their head into school, and the pharmaceutical industry is part of the problem. The pharmaceutical companies have spent billions and billions of dollars every year on marketing and advertising to make each and every one of us think this way. Just think for a second. Look at the commercials on TV. Yes, I watch a little TV now and then. I got to get into that kind of mindless, funny shows to just get away from it all. But the billions of dollars they're spending on these commercials. One of my favorites that I think resonates with most people I talk to, it's one for a diabetic drug. And you've got this guy, he's mowing the lawn and he's dancing and he's singing and he's having a great time because he's taking this drug, which subconsciously makes people think, I'm going to feel that way if I take this drug. Okay? But the fact of the matter is, I mowed lawns as a kid to make money to go to the movies. And I never danced and I never sang and I was never happy doing it, ever. So, but they put out these impressions and these subliminal thought processes and things that make you think, if you tell your doctor, I want to try this drug, you're going to be happy. And that's not how it works. In addition to that, chronic disease like thyroid issues, diabetes, heart disease, obesity, autoimmune, hormone imbalances, and there's a whole list more. All of these chronic degenerative diseases that are out there, they all equal one thing in the medical model: prescriptions for life. Okay? Prescription drugs for life. And so we just have to be willing to accept and surrender that that's just the way it is in the medical model. For those of you on here tonight, I'm not sure if you're a Medicare recipient. I see a lot of people in my clinic and around the country that I work with who are Medicare recipients. What they don't understand is they think Medicare takes care of everything, including washing the car and putting air in their tires. It doesn't work like that. This came directly out of the Medicare guidelines. Care that seeks to prevent disease, promote health, and prolong and enhance the quality of life. It should pay for that. I agree. I would have a waiting list of 6 months to a year. But guess what? Care that seeks to prevent disease, promote health, and prolong and enhance the quality of life is not considered medically necessary under Medicare. They will not pay. So when it comes to what we're doing is really helping people resolve those underlying causes and take back their life and get their body function normally and back to optimum health. Medicare is not going to pay for that. I want to make sure everybody understands that up front, because we see Medicare clients who think that it should pay for everything, and I agree, but it doesn't. So I want everybody on here to type yes in the chat if you agree. I will do whatever it takes to feel better and live a long and happy life. I just need the right tools, the right direction, and in my opinion, most importantly, the right coaching. I need to work with the right kind of doctor, the doctor who I believe has my best interest at heart and isn't writing me prescriptions just to get a trip from the pharmaceutical company. If you're willing to do something different, push yes, type yes in the chat box. I'd really appreciate it. Okay? Really, really appreciate your participation. I personally will do anything. It doesn't matter because I love my wife. You guys, you'll see a picture. I have a gorgeous wife and 2 beautiful kids in their mid-20s, and I want to be around long enough to hold and play with my great-grandkids if I can. And so I'll literally do anything. I don't care what it costs because it's that important to me. So this takes me to what's your why? What is your why? Well, my why is pretty straightforward. When I was 6 years old, my mom died of cancer when I was 6 years old. Now, if you can remember back to when you were 6, at 6 years of age, your mom is your everything. She is your everything. And she died at the age of 6, and it was a horrible experience. We had many months where she was in the hospital where they wouldn't let us visit her because of the hospital setting, and we were too young. And anyhow, she passed away. It was a terrible experience. And I told my wife when we got married the story, and I said, I make a promise to you. Besides my wedding vows, I make a promise. My promise is that I will do anything and everything I can to make sure that I'm healthy and you're healthy, so that when we do have kids and as they grow up, we'll not only be able to be a part of their lives growing up, but when they get married and have kids, that we will be a part of that. Okay? I didn't want my kids to experience what I experienced. So this is my why right here. This is my why. My gorgeous wife right here, my daughter, my son, I'm over here. I just turned 61, and so I kept that promise to my wife for the last 31 years, that I would literally do anything to make sure that I stay healthy so that my kids and I can experience life together when they have kids. Everybody's why is different. This here is Jeff. Jeff's why was pretty straightforward. When he came to see me, I was working on his back because he was having problems walking because of pain, but he weighed 290 pounds. And as we got to talking one day, I said, Jeff, are you happy with how you feel? And he said, no. He says, I can't walk very far. I have to stop and catch my breath. I can't take my son hunting and fishing. And that's our connection together. That's our bond. And he just listed off all of these things that he was missing out on. He was a full-blown diabetic. He was taking lots of different drugs. His liver wasn't functioning. He had high blood pressure, diabetes, heart disease. I mean, the guy was a mess, and he couldn't walk from a treatment room to the front door, which is maybe 100 feet, without stopping. It was terrible. So we had a seminar one night, and we said, why don't you come on? Let me invite you to my seminar. He came to the seminar, and in his testimonial here, he says, that he attended. I attended one of Dr. Rappe's health and wellness lectures, and I remember Dr. Rappe saying, quote, if you want a different outcome, you've got to do something different. That was my aha moment. That was my aha moment. And I knew right then I needed to do something different because the drugs weren't working. Well, he came on board with our program, and he has had an absolutely incredible turnaround. He has, let me see if I can click it in here. Here we go. He's 104 pounds. He lost 104 pounds off of all of his medications. His A1C went from 7.3 to 4.8. Huge drop. Look at his triglycerides, 864 down to 139. Well within range. Cholesterol, 267 to 180. His LDLs, that stands for lousy cholesterol. That's the one that people are so concerned is going to kill you. His LDLs were so high they couldn't even calculate it. And we were able to get it down to 88, which is right in the middle range. If you look at his TSH there at 5.95, he was laboratory high. He was actually having thyroid issues, but because they weren't testing him, they didn't know that. And then when we worked with him, we got him into the normal range of 2.32. His liver's functioning normally. And again, he lost 104 pounds. His why was simple. He wanted to maintain this incredible relationship with his son that he was losing because he couldn't function. And the guy's life has completely changed. And we're so grateful when we had this opportunity to work with him. Jeff, amazing. So do you have any of the following symptoms? Let's look at these. Some of you will say, I mean, I feel like this sometimes. Again, I do have a thyroid issue, exhausted, headaches, weight gain, unexplained weight gain, can't lose any weight. I don't understand. I've done everything you can imagine, every diet, I can't lose weight. My hair is thinning. Temperature swings or hot flashes. Constipation is huge. Constipation is terrible. Bowel dysfunction, irritable bowel, IBS. Why? Because your thyroid is associated with how your gut works. They're all interconnected. And of course, right now during COVID, a lot of us look like this at some point in time. Stress, anxiety, aches and pains all over my body, and then depression. There's been a lot of depression out there. You know, one week they tell you have to wear a mask everywhere, and I see people wearing it in the car, and then the next week you don't have to wear it, and the next week you can't get it off a service, then you can. It's really depressing not getting the information necessary for us to make really healthy choices for ourselves, because it all comes down to us making the right choices, taking responsibility for our own health and well-being, and not relying on our medical doctor to just write us another prescription. And then, of course, this one, right? This is pretty straightforward. People have sleeping issues all the time. When you have thyroid, you could very well have some issues with sleep or insomnia, as you will, and it's related to your thyroid and your pituitary, and it's all related. We're going to talk more about it as we go along here. Let's look at some thyroid metabolism. When your hypothalamus sends TRH to the pituitary gland, it's telling the pituitary gland to work. The pituitary gland is really, it releases TSH that stimulates your thyroid. So my pituitary gland is what tells my thyroid what to do, and it uses TSH, thyroid stimulating hormone, as a way of telling the thyroid to work harder and work less. That's the #1 tested thyroid test. It's even, actually, it's a pituitary hormone, but they test you with that in order to identify if your thyroid's functioning, and it's a mistake in most cases. And then TSH really stimulates the thyroid. TSH from the pituitary stimulates my thyroid to work harder and to make more and release T4 and T3. Those are the two hormones that your thyroid is going to manufacture. So your thyroid is going to make 93% of what your thyroid makes is T4, 7% is T3. We were designed that way in order to make our body work together as a whole. If your body's not functioning and your organ systems aren't functioning together as a whole, you can't convert T3 into T4, as you're going to see here. T3 is the most important hormone in the entire body. Every single cell has receptor sites for T3. So T4 goes to the liver, and 60% of T4 gets converted to T3 in the liver. Then some of that T4 gets converted to what's called reverse T3, which takes it back into the system breaks it down and reuses the parts, kind of like the parts for your car. And then 20% of that T4 is going to convert to T3 in your gut. So the mistake that I see a lot of my medical doctor colleagues make is this: if your TSH is high, automatically they tell you your thyroid's not working. Here's your hormone. But we can see by this little chart here, if my liver doesn't work like it should, I can't convert T4 to T3. The end cells are going to tell me there's not enough T3. It'll send a signal back to my brain or my pituitary, and it'll tell the pituitary, hey, there's not enough hormone. My TSH goes up. So now my elevated TSH is related to my liver, not my thyroid. Okay? In addition to that, if I have some gut issues, constipation, diarrhea, IBS, diverticulitis, if I have any issues in my gut, leaky gut syndrome, and I'm not able to convert T4 to T3 in my gut, there's going to be less T3 hormone at the end cell. They're going to send a signal back to my pituitary and say, hey, there's not enough hormone. You're going to have an elevated TSH. Your doctor will write you a prescription for thyroid hormone, rather than identify if my liver's working or if my gut's working. So again, functional medicine is what's the cause? Well, we want to look at, is it my liver? Is it my guts? What's going on? Am I not getting enough hormone? I'm not making enough. I'm not converting enough. I'm not absorbing enough. So it's really important that we really dig deep and find out what's the real underlying cause. Again, every single cell in the body has thyroid receptors. That's why it's so important. And 90% of hypothyroid cases in the United States are due to autoimmune disorder like mine. I have Hashimoto's. That's what it's called, Hashimoto's, where it looks like you have a thyroid problem, but you don't. You have an autoimmune condition. And that's treated completely different than if somebody had a real direct hypothyroid condition. Now, the medical model, for the most part, most of you on here, I can't speak for everyone, but most of you on here, your doctors don't even acknowledge an autoimmune condition. And if they do identify it, they're going to write you a prescription of drugs anyway. We completely do just the opposite. We focus on the immune systems to get it to stop attacking the thyroid, and therefore our Hashimoto's can be put into remission, as you'll see when you see my lab testing. So the immune system is really simple. There's two sides to it, Th1 and Th2. Th1 is the investigator, like Sherlock Holmes. He identifies the bad guys. He identifies the things that come into my body that might trigger my immune system. The Th2 over here, see it? Th2 on this other side, they're the destroyers. Once the Th1 marks something as a bad guy, we build an antibody. Everybody hears antibodies in the news lately. You're going to build an antibody, and your brain and your immune system remembers the antibody. So next time I'm exposed to that trigger, the immune system goes, okay, guys, Th2, get out there and kill it. And then Th2, these guys over here go out and destroy it. So we've got to be in balance. When we get out of balance and we have way too many aggressive Th2s, that's when we're in a flare-up. A flare-up would be a thyroid storm where your immune system is literally attacking your thyroid, and you've got these crazy symptoms, and your medical doctor keeps trying to give you drugs, increase your levothyroxine, decrease your levothyroxine. They're doing all this. They're chasing their tail to try to fix your laboratory tests. The problem is they're not addressing the immune system, and we've got to get the immune system in balance. And you'll see this is what I did with my testing. 25% of the people that have one autoimmune condition will have multiple. In my case, I do have something other than Hashimoto's. I have Sjogren's is also an issue. You've got lots of other ones. Let's take a look at some of those. You can have a pancreatic or a pancreas, which would be diabetes autoimmune. You can have myelin with multiple sclerosis, brain cancer. Your brain can have Parkinson's, Alzheimer's, and dementia. Those can all be associated with an autoimmune condition to your brain. Intestines, Crohn's, IBS, diverticulitis, joints, rheumatoid arthritis, endometriosis for the uterus, and then stomach, pernicious anemia, and lastly, spine, osteoporosis. So these are just some of the tissues that your immune system can attack other than just your thyroid. So right now, if you're interested, you already decided you'd like to do a discovery call, Here's the link to this discovery call. Lori's going to put it into the chat box. You can get on there and get a time set up where you can call us. And again, the discovery call is all about identifying what's going on with you and if it's a good fit for what we do in our office, because we don't take on clients that we don't think we can help. So this is an opportunity for a free call. So adrenals and the thyroid, the adrenal glands produce cortisol. They're little almond-sized glands that sit on top of the kidney, and cortisol swings are caused. Cortisol spikes are going to be caused in part by physical, chemical, and emotional stresses. Those are three stresses that everybody on here tonight, and in my opinion, everybody out there today is affected by these types of stress on a daily basis. There's nothing that can be done about some of them. We're exposed to chemicals every day. Physical stress, we can obviously do something with that. Emotional stress, most people don't. They just stuff it and it makes it worse. So if we look at stress here, you can see at the top, here's stress. There's your hypothalamus, pituitary, and here's your adrenal glands. When I'm under stress, my adrenal glands are going to pump out a bunch of cortisol. That's going to affect my TSH. Along with this, CRH can inhibit TSH production. So if I have high cortisol and high CRH, I'm going to have a low production, right? And it's going to make it look bad. My doctor's going to say, oh my God, your thyroid's not working. Your TSH is through the roof. We need to give you a hormone. And he doesn't test you to identify if it's cortisol, is it my adrenal glands, and what the heck is going on. In addition to that, you'll see that the cortisol can also block T4 to T3 conversion, which takes place in the liver and in the gut. When it does that, there's not going to be enough T3 for the cells, and the cells are going to scream at the pituitary to make more. Your TSH is elevated. Your doctor writes you a prescription for a hormone that you don't need. It's going to be liver, it's going to be gut, it's going to be adrenal glands. Okay? So it's very important to understand how that works. The relationship between cortisol and your thyroid is pretty straightforward. Cortisol lowers TSH, resulting in decreased thyroid hormone production, making your doctor think you got a thyroid problem, and he writes your prescription. Lower conversion of T4 into T3 is going to give you an elevated TSH. Your doctor's going to write your prescription. Okay? T3 is the most important hormone in the body. I mentioned it earlier. We have to have it. Every cell has to have it to survive. In addition to that, cortisol is also going to block the thyroid hormone at the receptor sites on the cell membrane. So cortisol plays a really important role, and most people are never evaluated, ever. The people we see, no one's ever evaluated for adrenal gland dysfunction, ever. So has your doctor ever told you that your lab work is okay, but you still feel terrible? If your doctor has told you that, you've heard something similar to that, raise your hands, shout at the screen if you'd like, clap your hands, do something, okay? Because a lot of people have heard this kind of stuff from their doctor, and it makes me crazy, and I'm going to show you why right now that is an incredible mistake, and most people are really frustrated. So medical labs, where do the medical labs come from? Well, first off, the lab ranges are pretty inaccurate. You've got to understand something. The medical labs that your medical doctor uses are very large, really, really large. I'm going to show you in a second, really large. Where they get their data is this. All of the labs out there share data. They compile the data, and what they're going to do is they're going to use a bell curve to identify what's normal. When I was in school, they taught us about bell curves. I don't know what they're doing nowadays, but a bell curve means they take 2.5% off the top, 2.5% off the bottom, and then that in the middle is going to be your normal. Well, first off, ask yourself this. Who goes to the lab for testing? Healthy people or sick people? The vast majority of people that are going are sick. So the lab ranges are inaccurate because it's a bell curve, but also because the vast majority of data they're using is from sick people. In addition to that, in functional medicine, we use the same lab testing. We just narrow down the ranges so we can identify when you're healthy, when you're about to get sick, and when you're in crisis mode. So let's take a look at that. So for TSH, everybody on here knows what that is, thyroid stimulating hormone. You can see the normal medical range is 0.3 to 5.7. If you're anywhere on here, Your doctor says you're fine. Your labs are normal. You're okay. And you're in your mind, you're going, I feel like crap. My hair's falling out. I'm moody. I can't lose any weight. I have night sweats. I'm pissed at my husband or wife all the time, right? You're driving your car thinking, am I crazy? Why is he telling me my labs are normal, but I don't feel good? This is exactly why. 1.8 to 3 is what's called the functional lab ranges. When you're inside this range here, you're healthy and symptom free. Now watch what happens. When we go outside of the lab range, high or low, we start having symptoms right in here. 3.2, 3.5, 1.1, 0.9. That's when we're having symptoms. I go to my doctor and I'm having symptoms. He's telling me I'm fine because I fit within the 0.3 and the 5.7. Once we've exceeded the laboratory range, we're in full-blown crisis mode. That's when they write a prescription. So another thing that I have about the medical profession is they wait until crisis mode, until your labs tell them you're in crisis mode before they want to write you a drug to minimize your symptoms. So in this yellow symptomatic range is where a lot of people are when their doctor says, your labs are normal. I don't know what's the problem. And the staff treats you like you're a wacko. Okay? This is why that's happening. You've got to have better testing done in order to get healthy. Here's another example. Let me move my picture out of the way. Let me put it down here. Your doctor says to you, your TSH and T3 is normal. You're fine. Look at this. TSH, normal, 2.35. T3, 101, normal. So your doctor is telling you you're normal. The staff is treating you like, why are you bothering us? Why are you in here? Well, here's why. If he did his homework and tested you properly, look at these. Crisis mode, crisis mode, crisis mode, crisis mode, crisis mode, pre-crisis mode. So out of all of these tests, he only ran 2 and they were normal. So he says you're fine and treats you like you're nuts. That's the problem. That's what's happening. We run all of these tests. In addition to that, we run the autoimmune test to identify if anybody's autoimmune. We use these tests to really take people who aren't healthy, who are having symptoms, who don't feel well, and we get them back to normal. So it's not just TSH. It's also going to be T4, T3, free fractions of T4, free fractions of T3. T3 uptake means how much of the hormone T3 is actually getting up into the cell, and then reverse T3. But most importantly, we also want to run the thyroid peroxidase or TPO and thyroid globulin antibodies. This is going to tell us if you're autoimmune because we treat you differently. If you have an autoimmune condition, you're going to do what I do because I have the same thing you have. If you don't, then we're going to treat you getting your liver better. We're going to fix your gut. We're going to really correct the underlying cause so you can be normal again. Here's my lab test. I just want to prove to everybody I wasn't making it up. Back in 2017, you can see that my number was 1.8. It should have been less than 0.9. So it was double what it should have been. This is a test for autoimmune. This is Hashimoto's. And you can see here that I have my Hashimoto's has been in remission since 2017, since this test. Okay? So when you're working with a practitioner, you're working with a medical doctor, if they don't have a thyroid condition like you, they can't understand when you say, you know, I feel this, I feel that, or this happens or that happens. They just don't have a Scooby-Doo. They just want to change your drugs, raise it or lower it. That's it. And then move on. So working with someone who has the same kind of condition you have is really important in my opinion. This is one of our clients. She's a snowbird. And it was just, she did such a good job. I wanted you guys to hear what she had to say.
Hi, my name is Arlene, and I'm from Vancouver Island, British Columbia. I came to see Dr. Rappe at a dinner workshop he had last spring. And I was interested because I need to lose some weight, I had thyroid issues, anxiety, just sluggy overall, not feeling great. So I went on the program and ended up, I was really terrified of the detox, but panicked me, and yet I did it, and it was really cool, and it was easy, and my family all are amazed. I've come out of this losing 20 pounds, I really need to do about 10 or 12, but I'm happy at 20. It's perfect. And I had an autoimmune disease called Hashimoto's. And now with my second blood work, it shows that I am now in the positive, the negative from the positive. So it has cleaned itself up. And I'm really thrilled. And I would recommend this program to anyone who would like to see themselves getting better health and feel better and enjoy life. Thank you.
So in her case, I did for her what I do for myself. We were able to give her Hashimoto's into remission, and she stayed that way for years now. It's fantastic, fantastic story. So we're going to go to the next page here. These are the 3 R's of our wellness program. You can see that. Here's the 3 R's Thrive Functional Wellness Program. The 3 R's are pretty straightforward. We've got to remove the toxicity first. We got to get rid of those toxins that are keeping your liver from working, your gut from working, your endocrine system is all screwed up. We've got to remove toxicities first and get our body functioning normally. Once we do that, we are going to resolve your underlying cause. Remember, functional medicine is about fixing the underlying cause, resolving it, not suppressing it using drugs. And then we want to rebuild organ systems from the gut out. The gut really plays a big role in a lot of conditions that we see out there today. And we see a lot of people that don't think they have a gut problem until we start working with them. We want to use all natural methods in our quest to get you well. As remember, this is a holistic approach. So can you change the future of your health? I say sure, yes, absolutely. We want to order all the right tests. I have a lot of people come to me and I say, let's look at your labs. And they're just so minimal. How does anybody know what to give other than to write a prescription? We want to determine the true underlying cause. Focus on the cause, not your symptom. We don't want to do this. We don't want to alter your lab with drugs. We want the truth. When you come to me and your cholesterol is in the normal range, but you're taking a big statin dose, well, what's really going on? Okay? So we don't want to alter your labs. We want to correct the dysfunction. We address the body as a whole because you're a whole human being. You're not just a thyroid. You got a pancreas. You got adrenal glands. You got kidneys. You got a gut. You got a cardiovascular system. So we want to treat the whole body, and we do that in the process that we work with here in the office. We also have mentoring, coaching, and using team support. A huge part of our success is that we take people by the hand and we walk them through a very straightforward step-by-step process. We have got to teach you. Teaching someone is this. We've got to teach you, what am I doing? Why am I doing it? And what's my long-term benefit? By making sure that all of our clients are fully educated in a curriculum-based format, we teach them why. This is where we get these long-term results, because now they fully understand what they're doing and why they're doing it. So again, it's a curriculum-based program. We teach you the knowledge and information, then we teach you how to apply it every single day on a daily basis, and that's how we get the long-term results. Coaching is huge. I was in the Olympic trials in 1984 as a pole vaulter, and I got to that level of athletics because I worked with a group of people that coached me and mentored me. It's very straightforward. So we apply that same methodology in our office. These are what we call the 5 pillars of health. We treat the whole person by putting these pieces together. First, we've got to clean, cleanse, and repair. We've got to detox your body. Have to. I don't care if you say, I'm eating the best nutrition on earth. If your body isn't clean, cleansed, and repaired, that nutrition isn't doing you any good. You're wasting your money. Then we roll into science-based nutrition. There's a lot of things out there in nutrition right now. There's a lot of special interest groups that are pushing their personal ideology. It's not healthy. So everything that we do here is based on science. We teach you what to eat to be healthy and what to stay away from that makes you sick. We have to have fitness has to be a part of our daily life. We require our clients to do fitness 3 days a week, at least a minimum of half an hour. But we teach you the methodology that'll help you be successful. Most people don't understand that, and so it's really important. A lot of us are busy, we don't have time, but if you can do what we teach you 30 minutes, 3 times a week, you're going to get incredibly healthy doing so. And then, of course, hormones. Hormones is huge. I've done a lot of postgraduate work in endocrinology. You've got to balance your hormones. Cortisol is a hormone. TSH is a hormone. Insulin is a hormone. They all interact with each other, and many times in negative manner. This one causes that one to be negative. This one causes that one to be negative. And next thing you know, we've got this whirlwind of negative things happening in the body. So we've got to test you and identify what's going on with your hormones and then balance you out using all natural methods. And lastly is nervous system. The amount of research that's come out in the last 5 years on the brain and how the brain works with this huge onslaught of Alzheimer's, and it's only going to get worse unless we take the dragon by the tail right now. The nervous system is so connected to your gut and how your gut works. The communication between my gut and my brain is absolutely vital. You've got to have a good functioning gut. We have to have good bacteria, and we have to have an interaction between the two in order for us to be healthy. And there's some huge research that shows there is a connection between poor gut function and the onsets of dementia, including Alzheimer's. And that's why I used it as in the list. So it's really important. 94% of failure is due to not having a system. As I mentioned already, we have a system that we put in place. We build this system for our clients. We teach you the information and knowledge and show you how to put it together in a systematic format and apply it in your life. We apply the knowledge, and we also have the supporting of a certified coaching, functional medicine, as well as mentoring to keep you on track. Everybody stumbles and falls. I do. Okay, getting back on track is the key to what we do in our office, especially when time's tough and we're having some difficult moments. So again, together we can make a huge change. The first step that we need to identify is this. We want you to complete a free call. We call it a discovery call with our clinic director. There's my gorgeous wife. Aren't I the luckiest man on earth? Yes, I am. Okay, so first thing is to schedule a call. The call isn't going to be an hour, but the call is going to be 15 minutes, 30 minutes, 15 minutes, somewhere in that range. We want to identify what's going on with you. Okay, what have you tried in the past to address your health concerns that haven't worked? That's important to us. What have you tried? And then how can our functional medicine practitioner, myself, and our support team help you? What do we have in the office that we think is a good fit for you? And then a plan of action preparing you for your first appointment. So this is really to establish whether we can help you or not, if it's a good fit, and if you'd like to take it to step two. Step two is really consulting with me. This is a personal one-on-one consultation. I do it virtually or I do it in person. My normal fee is $287, but because you're on here tonight, we offer a discount for these calls that we do online, these Zoom calls like this. And it's really the purpose is to identify what's going on, what do I think that we need to do with you. I customize a program for your particular needs, what you want from me, and we set a plan of action moving forward and with what we're going to do with you. We decide to work together. So it's pretty straightforward. The call first, let me go back to that, but first we've got to complete step one. You've got to get on and make a call, and Lori will schedule you. You can go on the Calendly, and it'll really set you up for success. And I'm just so excited to have you on here tonight. I look forward to talking to each and every one of you and helping you get the same results that I've gotten and the thousands of clients that I've worked with the same kind of thyroid disorders that we're seeing on here tonight. Lastly, don't procrastinate, okay? Your health is important, all right? Your health is really important. And you can't keep putting it off, because the longer you put it off, the harder it's going to be to recover from, if you might even get to the place where I just might say to you, I couldn't help you. So now is the time. Don't waste any more time. Get on the call with Lori, and please schedule that discovery call. And I'd like to say thank you to everybody. I appreciate it. This has been my passion my whole life. For 31 years, I've worked diligently day in and day out, long, long hours. Lori and I both have, to help as many people as possible. That's our thing. I don't want anybody to experience what I experienced as a little kid. And so it's been my passion. And if you haven't noticed that by now, this is really, it's my passion. And I love what I do. So please make the appointment, and I look forward to hearing from you. Thank you so much. I appreciate it. Have a good evening.